Hi, everyone. I see you joining the webinar. We are going to get started in about 2 minutes. We are going to go ahead and get started. Hi, everyone, and welcome to today's webinar on housing, health, and energy, how they fit together in their federal budget outlook. My name is Rebecca King, and I'm a policy associate with the National Housing Conference. I'm going to run through a few introductory comments, introduce our speakers, and then we'll dive into today's presentation. To start with the most important thing, our speakers. We have Ellen Laurie Hoffman, Mark Wolf, and Michael McKnight joining us today. Ellen Laurie Hoffman is the Federal Policy Director for the National Housing Trust. Mark Wolf is the Executive Director of the Energy Programs Consortium, and Michael McKnight is the Vice President of Policy and Innovation for the Green and Healthy Homes Initiative. We're going to start with Ellen to open us on housing, shift to Mark to talk about some energy programs like LIHEAP and weatherization, and then Michael's going to shift us over to health, and then we'll get into a little discussion about how these programs intersect and support each other before diving into your questions. Just for those of you who aren't familiar, here's some information about the National Housing Conference, which I'm not going to read, but I will say we do educate decision makers and the public about housing policies and practices to move housing forward together. One area where we've been engaged with the field to discover best practices and challenges, as well as around advocacy at the federal level, is housing intersections, and specifically related to today's webinar, how housing, health, and energy programs intersect and support each other. As part of this work, NHC convenes the Green Affordable Housing Coalition, as well as a smaller working group focused on housing, health, and energy. We know that affordable housing residents benefit when their housing is not just affordable, but energy efficient and healthy. And we know that many of the families served by housing programs are also served by federal energy and health programs. So we wanted to host this webinar to share information not just focused on housing, but also energy and health and their federal budget outlook, as well as discuss advocacy so that we can all advocate across these areas together. To touch on a few logistics, we are recording this webinar, and an archived copy will be made available on our website. Once the recording is online, we'll send a link to everyone who registered. Barring any technical difficulties, we should have this posted within the next 48 hours. Second, please note that your lines are muted to ensure clear sound quality for everyone. As I mentioned, we'll be taking questions at the end of the presentation, but if you have a question at any time, you can go ahead and submit it through the question box in the GoToWebinar control panel, and then we'll address it during the Q&A period. Lastly, on the topic of technical difficulties, while we hope the webinar runs smoothly for everyone, we are aware this doesn't always happen. If you run into any technical challenges, please use the help menu at the top of the GoToWebinar control panel to locate technical support. If that doesn't work, you can visit the GoToWebinar support website, support.citrixonline.com. With all of that out of the way, we will dive into today's presentation. Bear with me 1 minute while I shift things over to Ellen Lori Hoffman.
Okay, you ready for me, Rebecca?
Yes.
Okay. Well, thank you, and I'm trying to make sure that you are seeing the full screen here. I'm not. Sorry,
you go
everyone.
On the slideshow bar, the slideshow option at the top.
Okay. Okay, thank you. Sorry about that. Thank you, Rebecca. I'm really pleased to be part of this webinar today. The National Housing Trust, just very quickly, is a national nonprofit based here in Washington, D.C. We're focused on preserving existing affordable rental housing. And I will talk at the end of the webinar about our project Energy Efficiency for All, which looks at the intersection of energy efficiency and affordable housing. But Rebecca asked me today to focus on sort of our top 2 affordable housing priorities this year as we deal with Congress and the administration and what our advocacy message is. So I'm going to quickly provide an overview of low-income housing tax credits and project-based rental assistance. I'm going to come back to that slide. So I wanted to start with low-income housing tax credits, which is something that actually we're focusing quite a lot of attention on today, but the Senate prepares to mark up its tax bill, and more on that in a minute. And just a very quick explanation, low-income housing tax credits provide the private sector with an incentive to invest in producing and preserving affordable rental housing. The Treasury Department issues housing credits to every state based on a per capita allocation, and then the states establish allocation plans for their credits and award credits to developers. Project-based rental assistance, while also providing affordable rental housing, goes about it, and also being a public-private partnership, is set up in a very different way. It's a federal assistance program administered by HUD, and it provides affordable housing for over 1.2 million low and very low income households across the country. So HUD administers the project-based rental assistance and provides assistance to private owners of multifamily housing who receive a long-term rental assistance contract, which basically pays the difference between what low-income renters can afford to pay, assuming no more than 30% of their income for rent, and then the cost of keeping up that housing. I'm going to circle back now and talk about the low-income housing tax credit and why at this moment in time it is very much at risk. So the housing credit is, I have on my slide, the most successful tool. It's also sort of the only tool for producing and preserving affordable rental housing that we have today. Housing credits, which are used in conjunction with private activity bonds, also issued by states, have financed over 3 million affordable apartments since the program was created over 30 years ago. They've provided homes for approximately 7 million low-income families, seniors, veterans, people with disabilities. We are right in the middle of discussions in Congress about tax reform. The House tax bill, which came out about a week and a half ago, would protect the low-income housing tax credit. And I should say that this program has very strong support in a bipartisan manner in both the House and the Senate. So we were pleased that the House bill would protect the tax credit, but unfortunately it calls for the elimination of private activity bonds, which are used with about half of all allocated. So without the private activity bonds, if those were eliminated due to passage of the House tax bill, we would lose about half the power of the low-income housing tax credit. The Senate bill, which came out last Thursday, which is in draft form, protects both low-income housing tax credits and bonds. So we will be pushing for Congress to support that bill, but there's a few changes. Just want to take another minute to explain the linkage between private activity bonds and what's called 4% housing credits. And it's a pretty complicated program, and I'm going to try to explain it quickly and simply. I'm happy to answer any questions. So there's two kinds of credits, 4% housing credits and 9% housing credits. 9% provide more equity, and they're allocated on a competitive basis by each state. 4% housing credits provide less equity, and they're paired with the use of private activity bonds. In other words, without the bond, if the bonds were eliminated, you cannot use the 4% credit. The trust studies the state's use of low-income housing tax credits for housing, for affordable housing, and what we've seen is that the dollar value of 4% credits allocated across the country has more than doubled since 2010. And we know that 4% credits are now responsible for about 50% of all housing credit production. So this is a really valuable resource. Private activity bonds are also used for lots of other projects, infrastructure repairs, which is really important for this group, housing, health, and energy. The private activity bonds are used to help build hospitals. They're used for a variety of things, but I think in the past year, 90% of their usage has been for affordable housing. So again, there are other issues with both the House and Senate tax bill that we're concerned about. First and foremost, that the tax bills would lower the corporate tax rate to 20%. Both of the bills would do that. That obviously would make low-income housing tax credits less desirable because they're going to be less valuable to corporations. There are several proposals to make programmatic changes to the housing credit to sort of keep it whole despite a reduction in the corporate tax rate. But none of those proposals have been included in either the House or the Senate bill. And we're hoping to see some amendments adopted that would go towards keeping the housing credit whole. And the slide that I have up goes into some of the details. I'm not going to spend a lot of time on that. It's extremely complicated, but suffice it to say that even if bonds are protected, we still have concerns about the value of the housing credit with a lower corporate tax rate. But again, there are proposals that could address that. And the message that we're sending to Congress right now is to protect the low-income housing tax credit, protect private activity bonds, and keep the program whole as tax reform goes through Congress. Switching gears very quickly, and this is a really quick overview of everything. Project-based rental assistance. Project-based rental assistance receives appropriations every year from Congress, which goes to HUD and then is sent out to the private owners who operate their privately owned housing that serves very low-income people. Over half of the 1.2 million households that receive project-based rental assistance have a member of the family that has a disability or who is elderly. And the average income is less than $12,000. So it is a very, very low income, needy population. I know this is the Housing, Health, and Energy webinar, so I want to just take a minute and talk about some of the supportive services that are provided at both properties with low-income housing tax credits and project-based rental assistance. But here I'm focused on PBRA. Many of the private owners of HUD-assisted properties do provide valuable supportive services for their residents, especially the elderly and disabled, that help them maintain their independence. And those services reduce the taxpayer expenditures at the federal level as well as the state and local level on other services. And I have listed here Medicaid, Medicare, emergency shelter, but I'm sure you can imagine if someone's receiving services on site, that's going to reduce their need to go elsewhere, and for the state, local, and federal governments have to pay for that. Okay, so last year we saw a proposal, I'm going to try to go over this quickly, from the Trump administration to reduce a lot of funding for housing programs. And fortunately, Congress pushed back on that and really didn't accept many of those proposals, but they still haven't funded housing programs for all of fiscal year 2018. Folks probably know that we're currently operating under a continuing resolution through December 8th, keeping funding levels at fiscal year 2017 levels with a small across-the-board reduction under the spending caps that were imposed by the Budget Control Act. Congress really needs to get its act together and pass another spending vehicle by December 8th, which is very soon. And so far, we really haven't heard very much about what's going to happen. We are advocating for Congress to come together in a bipartisan way and come up with a new budget deal that would raise the spending caps, eliminate sequestration, but it's unclear because we really haven't heard about any members of Congress that are participating in those negotiations. I just spent a day talking to members, staff for the House and Senate HUD Appropriations Committee. They don't know either. So nothing's happening right now, which probably points to the idea that we'll have another continuing resolution, just kicking the can down the road until early 2018, where the Congress will have to address this. It's also possible that a spending bill could get packaged in with the tax reform that's being considered, as well as legislation to raise the debt ceiling, which also has to happen. But the point that I want to make is that a continuing resolution for project-based rental assistance is really unacceptable. Project-based rental assistance is tied to market rents. Landlords receive what is a comparable market rent for their units, and that means that you can't just hold the funding level steady from one year to the next. There's also changes in contract renewals. There needs to be a new spending bill that provides a full 12 months of funding for project-based rental assistance to be sure that all of the low-income renters do not lose their housing, to make sure that property owners are able to operate the housing, continue to provide supportive services, make whatever repairs they need to, and so forth. So our top-line advocacy request for Congress is to support a new budget deal that would raise this funding cap and fully fund project-based rental assistance. And that is it for now, and I will talk a little about energy efficiency for all at the end towards the end of the webinar.
Thanks so much, Ellen. That was great. I'm going to shift things over to Mark for his presentation, and while I'm doing that, I do want to take a minute and mention that Ellen did a great job of some really key affordable housing programs. For those of you who are not housers, there's a long list of really important federal housing programs that do work with energy programs. The low-income housing tax credit is the most significant for production. PBRA is also significant, as well as housing choice vouchers, public housing, home, and the community development block grant, to name a few. If you're interested in learning more about any of those, please email me. Happy to provide more information there. But given the breadth of our webinar and the time, we couldn't touch on them all. So just bear that in mind. And with that, Mark, I'm going to turn things over to you, except my computer doesn't want to let me do that. Let's try again. There we go.
Great. Thanks, Rebecca. I'm Mark Wolf. I'm the director of two related organizations. The National Energy Assistance Directors Association represents all the state managers and directors of LAHEAP, or the Low Income Home Energy Assistance Program. The Energy Program Consortium is a research collaborative that NEADA, along with the other three national groups, represent state energy officials, the National Association of State Energy Officials, NARUC, the National Association of Regulatory Utility Commissioners, and NASCAP, the National Association of State and Community Services Programs, representing the state weatherization directors, set up a number of years ago to do cross-cutting research. So I really speak for both groups, and both LAHEAP and WAP, the Weatherization Assistance Program, are our two programs that focus on low-income energy, both affordability and energy efficiency. So maybe we can switch to the next slide. Overall, our situation going to 2018 is much better than I thought it would be, even as of a few weeks ago. The President's budget proposed to eliminate both LAHEAP and weatherization, which was kind of a surprise to us, because we thought that we were viewed as an essential program within both the weatherization and health and human services programs. We thought possibly the administration would just propose to block grant us, along with a lot of other programs, as a longer-term strategy to eliminate or cut back funding for these efforts. But instead, they proposed just to totally eliminate us. And that seems to come out of a report the Heritage Foundation did, listing many programs they thought were of questionable value. With LAHEAP, the rationale was that lack of effectiveness. And they also said, which was puzzling, a lack of performance measures data, which to us, we were surprised at, because we've had a multi-year effort to develop performance measures data with HHS. There's been a lot invested in that. So we were surprised that OMB kept saying we don't have performance measures data. It's still a work in progress. It's about a year away from being implemented, but there clearly is a very strong effort in that regard. On weatherization, was a little bit different, the argument. They said they didn't want to tell states what to do, which we again found puzzling, because weatherization comes with considerable flexibility for states. And they also basically said they thought DOE should just funding early stage research, and that was the key to their recommendation to eliminate both programs. So we can switch to the next slide. So here's what happened, and I think here's what maybe puts the importance of our program in perspective. And I think for those of you who work mostly with HUD programs, our program often doesn't connect as well with some of the HUD programs, because it's an HHS program. We use some different definitions for income eligibility. You use area-wide median income. We use federal poverty, the national poverty statistics. So there are some differences, but overall our program reaches mostly families under 125% of the federal poverty level, which I think is about 50% of median income. LAHEAP's funding is significant. It's $3.4 billion. That's what we received in FY17, of which about $400 million that goes directly to weatherization. So we really are one of the major providers of weatherization assistance, although we often don't call ourselves that. And here was the key that we were worried about. Our program funding is considered seasonal. So what that really means is that even though Congress, in this case, the temporary funding level only runs through December, and so programs tend to be funded proportionally, 365 days divided by the amount of funding. For us, that would be catastrophic, because a lot of our funding goes for winter heating. So they've worked out this art, it's a bit of an art form, where the administration over the last couple of years has agreed to release 90% of our funding. So essentially tying the committee's hands. So once you do that, you basically have our funding level. We didn't know if the administration would do it this time. They came in saying that they wanted to eliminate LAHEAP. So, there was an argument that they wouldn't release the funds, but instead, much to, frankly, our surprise, they released the funds about 2 weeks ago, essentially 3 days earlier than the Obama administration released the funds last year. So in spite of the fact they came in wanting to kill the program, they're doing all the right things to help it work. So for all purposes, FY18 funding is locked in. There's still 10% that's sitting out there, about $340 million, but we're not that worried about that. Even if the appropriations cycle doesn't get resolved till March, we have enough money to run our program. The other thing, just in terms of context, about 6 million households are served by LAHEAP, so it's a fairly large program. The average benefits are around $300 to $400. In the cold weather states, you can see much higher benefit levels, sometimes much to $1,000. So this is what helps poor families get through the winter heating season. There's also a cooling component to LAHEAP. I think about 10 to 15% of LAHEAP funding goes just for cooling. So cooling is not a large part of it, but it's significant. It's expected to grow, especially as we're seeing more and more cooling heat wave situations in the South and Southwest. What is different, though, for those of you who haven't followed LAHEAP closely for a while, up to about 3 years ago, we did have money set aside for emergency conditions like the heat wave that I think we had in Arizona and the Southwest. That's gone. All our money now is just the basic formula grant funds. Can we switch to the next slide? Weatherization, that's a much smaller program. Last year, I think funding was about $225 million. The House proposed to level fund it, which, again, we were a little surprised there because we thought, well, the House is going to be much more conservative. They have deep cuts in the overall energy efficiency budget, but they maintained LAHEAP weatherization funding, which we thought was pretty remarkable. The Senate proposed a modest cut to $215 million. About 40,000 homes will be weatherized under this budget. As Ellen was saying, we don't have full year appropriations yet. That'll hopefully be resolved, in December or early next year. But again, it signifies very strong support in the Congress for the weatherization program. Not enough to get more money, which, would be certainly a victory. But there seems to be a consensus to keep weatherization at its current funding level. There also seems to be a consensus to keep LAHEAP in place because this would have been an opportunity if they wanted to cut the program to go ahead and do it. Next slide. That's basically it for my presentation. I'd be glad to answer questions. Just the last thing to mention for those of you who are focusing on federal LAHEAP and weatherization programs, there is another related set of programs being developed at the state level to look at providing supplemental funding in terms of financing options, either low interest energy loans, or there's this new sort of property assessed clean energy program that we've been doing a lot of work on. The other piece that's there too, so there's $3.4 billion in grant money for LAHEAP and $220 million for weatherization. There's also another $2 to $3 billion of utility money that goes for bill payment and weatherization. So the combined effect is about $6 billion. So it's a fairly large effort, but it's not entitlement money, it is grant money. Discretionary grant money, which always puts the program at risk for changes that are difficult to anticipate. But so far, they both seem to have extremely strong and bipartisan support. Thanks.
Thanks, Mark. That was a great overview of LAHEAP and WAP for the audience. We're going to shift over to Michael now.
Thank you. And I'm with the Green and Healthy Homes Initiative. We're a healthy homes organization headquartered in Baltimore, Maryland, born out of working on lead poisoning, but now work on sort of holistic issues around health-based housing and environmental health. And I'll be talking about sort of some of the health-based housing programs on the federal level. So first, to start with at HUD, the Office of Lead Hazard Control and Healthy Homes. This is a smaller shop within HUD. If you look at the totals around the bottom row, currently funded at $110 million per year, and really is broken out into 4 different buckets of activities. So in the lead hazard control program, this is the program. It's a competitive award from HUD to local jurisdictions to address lead hazards, mainly focused around lead-based paint hazards. Usually the grants run around, for lead hazard control, $2 to $3 million per jurisdiction for about 3 years worth of activities. They are the eligibility around sort of lower than 80% area median income, targeted for families with children under 6 or families with pregnant mothers. There's the lead hazard reduction demonstration. That second row below is specifically targeted for those jurisdictions that have large numbers of pre-1940 occupied rental properties. As folks, I'm sure folks know, lead was banned in 1978, but many jurisdictions had phased it out prior to that. So if you're sort of thinking about the properties that have the most likelihood of poisoning a child, it's in that pre-1940 occupied rental properties, and those grants under the Lead Hazard Reduction Demonstration Program are a little bit larger, usually up to around $3.5 to $4 million per jurisdiction. In the Healthy Homes Initiative Award, which is currently funded at $20 million, these are funds that can be used for the other environmental health hazards that you might find in a home. And this could be asthma triggers, looking at mold, looking at asbestos, looking at potential for carbon monoxide poisoning, trip and fall injury hazards in a home, electrical hazards, sort of the non-lead hazards that might exist in the home. Several years back, there were standalone Healthy Homes awards for jurisdictions, but in the last 3 to 4 years, those Healthy Homes dollars have mainly been used as supplemental dollars that a jurisdiction can ask for when they're asking for lead hazard funds. So you could say, I want $3 million in lead funding, and I'm also asking for $400,000 of Healthy Homes funding as well. And those dollars can only be used in homes that you're also doing your lead hazard control work. And then the lead technical studies, just small research grants going towards jurisdictions. So looking at the FY18 White House request, actually there was an increase from 110 to 130. We think most of this is probably as a result of the increased attention on lead as a result of the Flint crisis and other jurisdictions looking at similar types of issues. I think also with Secretary Carson over at HUD, sort of looking at the intersection of housing and health makes sense for this administration. So there was a proposed increase in to 130. The House passed it at 130. The Senate actually went even higher to 160. So obviously, hoping that the Senate wins out, and was happy to see in both the White House and on the House and the Senate side, there was an increase in the Healthy Homes line, because there are so many other non-lead hazards in homes that can impact health. So then moving to a program within the CDC, over within HHS, the CDC Lead Hazard Control Program. This lies within the National Center for Environmental Health. There's the Childhood Lead Poisoning Prevention Program, currently funded at $17 million. So this is a program that funds the surveillance of blood lead statistics, funding state and local health departments on sort of identifying and helping to drive children that have elevated blood lead towards resources to impact that. It's really the eyes and ears of these states. And so while it's currently funded at $17 million, in both the White House, flat funding at the Senate and the House level, but one interesting sort of way that it's being funded. So in the previous years, it's been funded out of the prevention fund, the Prevention and Public Health Fund. Both the White House and in the House FY18 budget, they've proposed elimination of that prevention fund. That prevention fund has been used over the last several years to, I think, fund around 10% of CDC's activity department-wide, and so it's right now sort of locked in. And so while in the House and the White House request, they just put the lead poisoning prevention program under regular budget authority. The Senate, because they did not have the elimination of the prevention fund, kept the funding coming from the prevention fund. So there's a little bit of concern that lead poisoning stakeholders have, is that we would end up with the worst case scenario where there wasn't regular budget authority and the prevention fund gets eliminated. And it has been proposed to be eliminated in some of the Affordable Care Act repeal efforts on both the House and the Senate side. And then there was some additional funding as a result of Flint that was enacted in the omnibus at the end of calendar year 2016. And so it was $35 million to establish a lead registry in Michigan, and also do some more work with taking those kids that had elevated blood levels and looping them with case managers. And that money can be used through FY18. Then switching to another program within CDC, also within the National Centers for Environmental Health, is the CDC Asthma Control Program, currently funded just under $29 million. This is also sort of the eyes and ears. This is the public health efforts of asthma. Asthma, obviously a wide-ranging problem, around 24 million people with asthma in the U.S. And so this program funds state health departments, promotes different asthma control measures, and has had a specific focus on linking asthma efforts to home-based efforts to reduce environmental triggers, like mold, like pests, mice, cockroaches. There's asthma triggers such as VOCs, things like that. And so that sort of coordinating activity at the state level is really supported by the CDC Asthma Control Program. The White House FY18 gave it a little bit of a haircut. Both the Senate and the House have flat funded it in FY18. So looking at the intersection of all these different programs, you have these programs coming down from the federal agencies, hitting the states, hitting local jurisdictions. There has been challenges around sort of coordinating these different activities. One thing that Mark brought up is oftentimes you have different eligibility criteria across different departments and different programs, and really just trying to sort of coordinate different efforts. So the Green Healthy Homes Initiative established a model back in 2009 around aligning different programs and efforts, and we work in 30 jurisdictions around the country right now, doing efforts like a single intake system. So if a family or a home is in need, no matter who they call first, all of the different programs that are located in that jurisdiction are all aligned. Thinking about comprehensive assessments. So whoever walks into that property to inspect is not just thinking about maybe their one issue area, but is thinking comprehensively about the needs, and then helping to connect other programs, not their programs, to be aligned and address the issues that residents might have. Thinking about integrating interventions. So if we have mold, for example, that's in the house that's caused by a leak in a roof or whatever, there may be a different program that cleans up the mold than the program that fixes the roof, those sort of things. And so making sure that we are coordinating activities. And then cross-training workers. For example, the many energy auditors have a certification from the Building Performance Institute. BPI created a micro-credential for their energy auditors around health-based housing. So now you can be an energy auditor with a Healthy Homes micro-credential to go along with your energy audit credential. And then sharing data has been sort of a key aspect of trying to align these different programs, whether it is data around the potential clients, trying to coordinate activities. So we like to see this alignment amongst both energy efficiency, weatherization improvements, health and safety improvements, and addressing lead hazards. And just quickly to bring it home, this is a real case study from a family in Baltimore. You see there's multiple issues in this home, a row house, multiple allergens, lead hazards. It was poorly weatherized. There was a non-functioning furnace, 2 children at the home with asthma going back and forth to the hospital, missing school, able to have a coordinated intervention that utilized a new furnace from Constellation Energy, a utility, weatherization from WAP, funding from the Lead Hazard Control program at HUD to address both lead and healthy homes issues. Also braided in some funding from the Community Development Block Grant program there at Baltimore, and some education provided by the health department. So able to bring $18,000 of investment across multiple funding streams into this home, and we've seen great improvements for this family, not back to the emergency room or hospitalization, decrease in energy consumption, and better outcomes for the family. Thank you.
Thanks so much, Michael. And that is a great segue back to Ellen briefly before we open it up for Q&A, because these programs, housing, energy, and health, they do work together, or at least they can. And it's something important to highlight. And I want to just turn it back over to Ellen to touch on some of what NHT has been doing in a similar vein.
Sure. Thanks, Rebecca. I'm going to go back up. I'm going to quickly zip back up to my EFA slide. And so the Energy Efficiency for All project is one that the National Housing Trust embarked upon, I think, about 3 years ago. And the reason that we did is kind of what ties this all together, which is we know that low-income families can spend more than 20% of their income on energy costs. And in affordable multifamily, or in multifamily housing in general, the cost of utilities is the largest controllable operating expense. But we also know that it's much less common to have efficiency measures taken in multifamily rental housing than in other housing, like single family, privately owned housing. So the Trust got together with our partners at the Natural Resources Defense Council, the Energy Foundation, and Elevate Energy, with the goal of addressing this problem of expensive energy costs in affordable housing, or in housing in general for low-income people. We bring together different areas of expertise. Obviously, the Trust brings an affordable housing angle, but our other partners are experts in energy efficiency, community development, finance, and utility engagement. And the way that EFA works has traditionally been, up until the past year, at the state and local level. We collaborate with state and local groups across the country. We're currently operating in 12 states. And we bring tools and resources that can help increase energy efficiency investments in states' affordable multifamily housing. And primarily this has looked like going to state utilities who have resources that they are mandated to use for energy efficiency, and helping to make the case for why they should use those resources in multifamily housing that serves low-income people. We have been incredibly successful with this effort. And last year, after the election, when we saw so many threats to both housing programs and energy efficiency and health programs, we decided to expand the EFA project to include what we call federal defense, which is not a very good name because it sounds like military spending, but what it is getting our partners, both at the national and especially at the state level, to do some advocacy and education around federal housing and energy efficiency resources, and specifically housing credits and project-based rental assistance, which I spoke about, as well as the Weatherization Assistance Program and LIHEAP that Mark spoke about. So trying to, encourage civic engagement at the state level and make the connection and help people understand that there is a relationship between affordable housing, the challenges that low-income families face, both in affording rental housing and in affording to pay for their energy costs. And I think it all ties back into into health, because as Michael was talking about, but certainly we see that low-income residents who are not living in adequate housing and don't have the energy efficient housing are suffering in many ways from things like lead poisoning and asthma, and there's so many non-energy benefits that we can point to in addition to just lowering the operating costs in rental housing. So that is an exciting project, and has expanded the National Housing Trust, advocacy a bit, and we are really excited to work in partnership with groups at the national and state level.
Thanks, Ellen. And I'm going to take this opportunity before turning to questions, but please be thinking about questions and send them in. But I do want to take a minute and just echo something Ellen said, which is the need for a budget agreement to lift the caps and fully fund all of these programs we all care so much about. We need a bigger pie. It's not about getting our particular program funded, because if that's how we advocate, then low-income families are going to lose in the end. So we at NHC are pushing for a bipartisan budget agreement to lift the caps, and we encourage you to do the same in your advocacy. And I also want to make a plug. There's some policy materials on NHC's website you can see on relevant issues like Energy Star reform. EFA's website is also a great resource in terms of advocacy. So please check those out and reach out to any of us with specific questions on programs or advocacy. Our first question that came in, I'm going to go to Mark first and then welcome Michael and Ellen to weigh in with additional feedback. But we had a question about weatherization and how it's administered. Like, how are the monies spent? How do they decide how the funds get used?
Okay, weatherization, there are really two pieces there. So there's the weatherization money that comes out of LAHEAP, and that generally is transferred into the federal DOE weatherization program and managed there, but some of the money is not. So the LAHEAP funds, again, let me step back. All the federal money goes directly to state first. It doesn't go to local government, unlike all the HUD programs. So there are really 50 initial points of contact. Each state agency does their own plan, and there's a hearing process. So if you're looking to discuss the issue of how LAHEAP weatherization money or the DOE weatherization money connects with HUD dollars, that's really where the discussion takes place. After that, they use local nonprofit agencies to administer the programs. Generally, it's community action agencies, but not always. So in some states, the LAHEAP money or the weatherization money will go through other nonprofits. It all depends where you are. The big states like New York, Pennsylvania, California, they use social service agencies, state social service agencies, and then for the LAHEAP funds, and then for the weatherization money, primarily contract through community action agencies or agencies similar to community action agencies.
Great. We had another question come in, and I'm going to start with Michael. In case you know, it's about cities or states using Medicaid or Medicare for healthy housing programming.
Sure. Yeah, there's a number of efforts that people have been taking to try to unlock some healthcare dollars to pay for some of these things because of the impact that housing conditions have on health. So as an example, Michigan, in light of Flint, asked Medicaid about this, and CMS, federal CMS, came back and utilized CHIP dollars. So there was about $125 million that was awarded to Michigan for, that would be like 5 years of work where they could address lead-based paint and actually replace lead service lines, because CHIP is under different statutory authority than Medicaid. And so they were able to start that effort, and then a couple other states looked at similar types of, it's a CHIP state plan amendment. So Maryland got one enacted to do both lead hazard remediation and address environmental issues for asthma. That also got awarded. I think Ohio is waiting on their award, but that is CHIP dollars, so we know that that funding is unfunded right now. A couple other states have looked at. Missouri has been able to sort of create a code for housing assessments that they use Medicaid dollars for. A couple other states have looked at using value-added services or value-based payments where you're paying for services that Medicaid can't normally fund. There's also waivers that also can be used by states to fund additional services, where usually there's a match between state dollars and federal dollars for those additional services, and usually those waivers go for about 5 years, like 1115 waivers.
Great. So for folks interested in more on healthy housing programming from Medicare and Medicaid, and as Michael was saying, CHIP, reach out to Michael. GHHI is up to speed on this one. Also, the National Governors Association is doing a lot of work on health and Medicaid waivers and working closely with states on that. So they're also a good resource on this general question. So I will give it a couple more minutes to see if more questions are coming in while folks are thinking. I want to thank our speakers so much for their time and knowledge that they imparted, and thank all of you for joining us today. As I mentioned, we will make this available to you on our website, and you'll know when it's up because we will send an email. And I'm seeing another question. Oh, can you, Michael, just elaborate on the CHIP funding, what the acronym stands for?
Oh yeah, that's Children's Health Insurance Program. So this is the program that was created in the mid-90s to expand or basically reduce the amount of kids that were uninsured and didn't have health care coverage. And while it is in many states administered very similar to Medicaid, and sometimes is sort of seen as like a joint program with Medicaid because it was created in the mid-90s and not under the when Medicaid was created back in the 60s. So it's under different statutory authority, and so there's a little more flexibility within CHIP to do certain things. And so there's a state plan amendment that could be done within the CHIP program to cover things like lead and asthma around housing conditions.
Thanks for that, Michael. I'm so glad you shared that because I knew about using waivers to do different things within Medicaid, but I was unfamiliar with kind of the options under CHIP. So I learned something. Always a bonus. Well, I'm not seeing more questions, so I don't want to hold folks unnecessarily. So I will just close us out. Again, thanks to all of you for joining. Thank you again to our speakers. And as you can see, the contact information for all of the speakers is available right there. And we will share the materials with you in the follow-up email as well. So you can reach out if questions come to mind later. With that, I will release you back into your day. Thanks so much, everyone.